Imagine you are standing in line at a supermarket. Just a totally normal day.
Right, just holding a basket of groceries.
Exactly. You've got your basket. Maybe you're trying to figure out what to make for dinner. Or, maybe you're riding the subway home from a long day at work. Completely mundane stuff.
The kind of thing you do every single day without thinking twice.
Yeah, totally. And then suddenly, with absolutely zero warning, your entire world just begins to crumble.
It just hits you out of nowhere,
It really does. Your heart accelerates to like 180 beats per minute. It feels like it's quite literally trying to hammer its way right out of your ribcage.
which is terrifying.
Oh, it's horrifying. Your hands go numb, you break out in this cold sweat, and the air suddenly feels incredibly thin, and this single crystal clear thought just flashes in your mind.
This is it.
Right. You think, this is it. I am having a heart attack. I am literally dying right here in the dairy aisle.
And I think it's important to validate that for you, the listener. It is the absolute definition of terror. There is nothing, abstract or philosophical about it in that exact moment. It is entirely physical. It's completely consuming. And it just overrides every logical circuit in your prefrontal cortex.
So you do what literally anyone would do in that situation. You drop the groceries, you get the heck out of there, and you rush straight to the doctor.
You want answers. You want to know what just broke inside of you.
Exactly. So you undergo dozens of medical tests. I mean, they run ECGs, they put you in an MRI machine, they draw like a dozen vials of blood for these comprehensive metabolic and cardiac panels.
The whole workout.
The whole thing. And you're sitting there in the waiting room, just completely bracing yourself for this terrible news about your failing heart or your compromised nervous system.
Right, you're expecting a massive diagnosis.
Yeah, and then the doctor walks in, looks at your perfectly normal charts, and just hands down this bizarre verdict. They say, well, your heart is perfectly fine. It's just VSD, vegetative vascular dystonia.
Which, leaves you sitting there feeling completely baffled and honestly, probably a little insulted.
Oh, definitely insult. Because you know what you felt, right?
Exactly. You felt like you were dying. And the medical establishment is basically just handing you this random acronym and sending you on your way.
Yeah, you're handed this label. Maybe they prescribe you some mild vitamins or these obscure supplements for vascular support, and you're just pushed right out the door.
It's incredibly frustrating for patients.
It really is. But here is the actual shocking truth about that specific diagnosis and really the reality of the terror you felt in that supermarket line. The disease vegetative vascular dystonia does not actually exist in any international medical classification.
It is entirely a phantom.
A complete phantom. And what you mistook for this deadly physical ailment, a failing organ or some terminal condition, is actually the most brilliant, terrifying, and just elaborate trap set by your own brain.
It really is a trap, and it's a diagnostic ghost that has haunted millions of people, particularly if we look at Eastern Europe and post-Soviet medical systems, for decades now.
Right. Which brings us to the core mission of our deep dive today. We're going to unpack this massive stack of medical journals and clinical protocols to figure out what's really going on. But wait, if the disease literally doesn't exist, how did an entire medical system end up diagnosing millions of people with it?
That is the big question, right?
We're talking about real doctors at real clinics handing out this VSD label like it's candy. Where did this even come from?
Well, to really understand the persistence of this phantom, we have to look back at the post-World War II medical landscape, specifically in the Soviet Union.
Okay, so going back to the mid-century.
Exactly. The term itself was coined back in the 1950s by an academician named Savitsky. He was actually studying military personnel. These were veterans returning from just unimaginable trauma on the front lines.
Right, guys who had seen horrific things.
Yeah, and he observed these soldiers exhibiting really severe symptoms: high blood pressure, severe palpitations, chronic exhaustion, severe dizziness.
But their hearts were physically fine?
That was the mystery. When he examined their hearts, there was absolutely no underlying structural cardiovascular disease.
Well,
Hardware was fine.
wow. So he's looking at soldiers with what we, sitting here today, would instantly recognize as severe PTSD or chronic anxiety disorders.
Right. But he is viewing it entirely through the lens of 1950s cardiology.
Which is a huge distinction.
It is, because in the context of mid-20th century Soviet medicine, psychiatry was highly stigmatized. It was distinctly separated from general medicine.
So a cardiologist isn't going to diagnose a mental health condition.
Exactly. Savitsky needed a physiological explanation for these very physiological symptoms. So he concluded that the high blood pressure and the rapid heart rate were the results of a failure in the autonomic nervous system's control over the blood vessels.
Ah, I see. A literal dystonia of the vascular tone.
Precisely, hence the name, vegetative vascular dystonia. And to be fair, at the time, it was a genuine good faith attempt to categorize a really confusing array of symptoms.
Right. They were working with the tools they had, but I mean, science globally moved on from that. We developed functional MRIs, we mapped the human genome, we mapped out all these neurotransmitter pathways.
We figured out what was actually happening under the hood.
Exactly. Yet, in the CIS and these post-Soviet medical systems, this VSD label didn't just survive. It basically metastasized into this massive catch-all category. It really became a diagnostic garbage bin.
Diagnostic garbage bin is the perfect way to put it. Because it just became an incredibly convenient administrative tool.
How so?
Well, consider the reality of your average modern general practitioner. A patient walks in with this long laundry list of migrating, confusing complaints.
Right, like dizziness today, heart palpitations yesterday, crushing fatigue the day before.
Exactly. And the doctor has, what, maybe 15 minutes to see this patient? They run a basic blood panel. They run an ECG. The results come back perfectly clean.
So they're stumped.
They are. And instead of embarking on this highly complex, super time-consuming diagnostic search into the patient's psychological state or their chronic stress load.
Or running specialized endocrine tests.
Right. Instead of doing all that, the doctor just writes VSD on the chart.
It's the easy out.
It satisfies the administrative requirement for a diagnostic code. It saves the doctor a ton of time. And, critically, it gives the patient a name for their suffering.
I get the administrative convenience of that, I really do, but man, it creates this massive illusion of treatment that seems incredibly dangerous for the patient.
It is deeply dangerous.
Because the patient leaves the clinic thinking, okay, my physical hardware is broken, I have bad vessels.
Right, they internalize a physical illness.
Yeah. So they go straight to the pharmacy and they buy all these over-the-counter supplements or adaptogens or basically placebo pills designed to support vascular health. And they take them religiously, just sitting around waiting for their anxiety to magically go away.
Which is a fundamental mismatch of pathology and treatment. I mean, treating vessels with vitamins when the actual root cause of your suffering is an overactive amygdala and a dysregulated nervous system, it's biologically absurd.
It makes no sense.
Let's look at this through the lens of a severe viral infection. Imagine you contract the flu. Your immune system mounts a defense, and as a byproduct, your core temperature rises.
Right, you get a terrible fever.
Exactly. Now, imagine if your doctor only prescribed you antipyretics like fever-reducing pills and told you that the fever itself was the disease.
Oh, wow. Yeah, you take the pill, you'd sweat it out, your temperature drops to normal for a few hours, and you think, great, I'm cured.
But you're absolutely not. The virus is still actively replicating in your cells.
So treating the somatic symptoms of anxiety, which is what VSD actually is, with vascular supplements without addressing the underlying psychological distress, it's literally just treating a viral infection with fever-reducing pills.
That's exactly what it is. You might get a temporary placebo effect. You know, you feel a little calmer just because you took a pill. But the virus, the underlying anxiety disorder, the chronic stress, all those cognitive distortions remains completely untouched.
And honestly, it sounds like it's actually worse than just being ineffective.
Oh, it's actively harmful.
Because by constantly monitoring your physical symptoms, like taking your pulse every 10 minutes, checking your blood pressure, swallowing these pills for your weak vessels, you're actively training your brain to become hypervigilant.
You are reinforcing the neural pathways of fear. Every time you check your pulse, you are teaching your nervous system that your body is fragile and under constant threat.
You're just locking yourself inside the trap, and the ultimate proof that this is a localized myth is just glaringly obvious when you look outside those specific regions.
The international consensus is very clear.
Yeah, if you open up the ICD-10 or the newly implemented ICD-11, which is the International Classification of Diseases used globally by the World Health Organization, you will not find vegetative vascular dystonia. It literally does not exist in there.
Not at all. The global medical community categorizes these exact same patients very differently.
What do they call it instead?
When a patient presents with severe physical symptoms that are driven by psychological distress, it falls into categories like bodily distress disorder, somatoform disorders, or unspecified autonomic nervous system disorders.
Okay, so the terminology shifts the focus entirely.
Right. The international consensus says the physical symptoms the patient feels are 100% real. The pain is real. But the etiology, the root cause, is psychiatric or neurological. It is not a structural defect of the cardiovascular system.
But wait, that puts a massive burden on the doctor to basically act like a detective, right? Because if VSD is just a mask, what is actually hiding behind it?
That's the real challenge of diagnostics.
Right, because you can't just tell every single patient with a racing heart that they have an anxiety disorder. You have to rule out the real physical mimics first. The somatic filter has to be absolutely airtight.
A rigorous somatic filter is the absolute cornerstone of responsible medicine. I mean, before a physician even whispers the word anxiety or somatoform, they have to rule out conditions that perfectly replicate the exact physical sensations of a panic attack.
What's an example of a mimic like that?
A classic one is iron deficiency anemia.
Oh, really?
Hmm.
Anemia can cause panic symptoms.
Absolutely. If your ferritin levels crash, your red blood cells just can't carry enough oxygen to your tissues. This creates a state of cellular suffocation, which we call tissue hypoxia.
So your cells are literally starving for air.
Exactly. And your brain senses this drop in oxygen and it panics. It sends an emergency signal straight to the heart. Pumped faster, we are starving for oxygen down here.
Wow, so you develop compensatory tachycardia. Your heart races to make up for the lack of iron.
Yes. Your heart races, you feel short of breath, you feel weak. It feels exactly like a panic attack, but it's actually just your heart trying to keep your organs oxygenated because you don't have enough iron.
That is wild. And if a doctor writes that off as just stress without checking a full iron panel, they are basically committing medical negligence.
Without a doubt. You have to check the blood.
Another massive mimic the sources mention is the thyroid gland. And the endocrinology here is just fascinating because the thyroid basically dictates the metabolic speed limit of your entire body, right?
The thyroid is the master regulator. It really is. If you have hyperthyroidism, which is an overactive thyroid gland, often caused by autoimmune conditions like Graves' disease, your system is flooded with excess thyroxine, which is T4, and triiodothyronine, or T3.
And what do those excess hormones actually do to the body?
They do something very specific. They upregulate the beta-adrenergic receptors on your heart muscle.
Okay, meaning what exactly?
Essentially, they make your heart violently sensitive to even normal, everyday amounts of adrenaline. So your resting heart rate spikes to like 110, you develop a fine tremor in your hands, you sweat profusely, and you lose weight rapidly.
So it looks and feels exactly like acute anxiety.
It is biologically indistinguishable from severe acute clinical anxiety.
That is terrifying. And the reverse is true too, right? Hypothyroidism, an underactive thyroid, causes your metabolic rate to just crash.
Exactly. You experience profound apathy, extreme fatigue, brain fog, and a normally slow heart rate.
Which perfectly mimics severe clinical depression.
This is exactly why the blood panels are non-negotiable. You check the complete blood count, the ferritin, the thyroid-stimulating hormone TSH, and you run the ECG to check the electrical pathways of the heart.
Okay, let's play this scenario out for a second. Let's say I do exactly that. The doctor runs all the panels, my iron is perfect, my TSH is totally optimal, the ECG shows a flawless, perfectly healthy sinus rhythm.
Okay, clean bill of health on the hardware.
Right, there's absolutely no organic disease, my hardware is pristine. But I'm sitting there in the clinic, and my chest is tight. I feel like there's literally an elephant sitting on my lungs. My fingers are tingling.
It's all happening.
Yeah, if the illness doesn't exist, if my heart is completely healthy, who or what is hijacking my body to make it feel this way? I mean, why does the symptom feel so incredibly real if it's, quote unquote, just in my head?
Because it isn't just in your head.
Okay, say more about that.
That phrase is honestly the greatest disservice we do to patients with anxiety. We imply that the symptoms are imaginary, but they are not. The pain is real, the tachycardia is real, the shortness of breath is real. These are profound physiological events happening right there in your tissue.
So where is it coming from if the heart is fine?
To understand why a perfectly healthy, mechanically sound heart can cause you agonizing chest pain and basically mimic a myocardial infarction, we have to look under the hood of human biology.
Let's do it.
We have to examine the autonomic nervous system, the ANS.
The unseen control room. Let's really get into the deep anatomy of fear here.
The ANS is the division of your nervous system that operates entirely below the level of conscious thought. It is your body's autopilot.
Right, it's doing the stuff we don't have to think about.
Exactly. It regulates your heart rate, the peristalsis of your digestion, your core body temperature, the dilation of your pupils, the constriction of your blood vessels.
Which is brilliant, honestly, because if we had to manually operate our own bodies, we'd forget to breathe the second we got distracted by like a text message.
Oh, we would survive a day.
Yeah.
A great way to visualize the autonomic nervous system is to think of it as the gas and brake pedals of a highly tuned sports car.
I love this analogy. Let's explore the gas pedal first.
So the gas pedal is the sympathetic nervous system. Its primary evolutionary mandate is keeping you alive in the face of acute, immediate physical danger.
This is the famous fight or flight response, right?
Exactly. When your brain, specifically the amygdala, which is that primitive fear center deep in the temporal lobe, perceives a threat, it sends a distress signal to the hypothalamus.
And the hypothalamus is like the command center.
Right. It acts as the command center communicating with the rest of the body through the autonomic nervous system. It sends an immediate nerve impulse down your spinal cord to your adrenal glands, which sit right on top of your kidneys.
And those adrenal glands just dump a massive payload of adrenaline and noradrenaline directly into your bloodstream.
Instantly. It is a flood. And the moment those catecholamines hit your cellular receptors, your body undergoes this violent, magnificent mobilization of resources.
Let's break down exactly what that mobilization looks like, because it explains so many of the weird symptoms people get in the grocery store.
Absolutely. First, your pupils dilate maximally. This lets in more light, increasing your visual acuity so you can track the predator.
That explains the blurry vision or sensitivity to light during panic.
Exactly. Then, the blood vessels in your skin and extremities constrict. This is why your hands go cold and numb. Your body is shunting that blood toward your major muscle groups.
Wait, really? It's pulling blood away from the surface on purpose?
Yes.
No.
So if you get scratched or bitten by the predator, you won't bleed to death as quickly.
Oh, wow. That makes so much sense. It perfectly explains the cold, clammy hands in the supermarket. It's not a vascular disease at all. It's just a strategic rerouting of blood flow.
Precisely. At the same exact time, adrenaline binds to the beta-1 receptors in your heart. This causes it to beat faster and with much greater force.
So your blood pressure just skyrockets.
It has to. It aggressively pumps oxygen-rich blood to your thighs and biceps so you can actually run or fight for your life.
Right. And what about breathing? People always feel like they can't breathe.
Simultaneously, the smooth muscles in your bronchi, the airways in your lungs, relax and expand. This is called bronchodilation, and it allows you to gulp in massive volumes of oxygen.
But because you're breathing so fast, it feels like you aren't getting enough.
Exactly.
Yeah.
And crucially, non-essential systems are immediately shut down. The blood supply to your digestive tract is drastically reduced.
Because your body isn't going to waste precious energy digesting a bagel when you are like 3 seconds away from becoming someone else's lunch.
Exactly. It is a breathtakingly efficient survival protocol.
That's the gas pedal completely floored. But eventually, in nature anyway, the tiger gives up or you manage to run up a tree and escape. What happens then?
Then the brake pedal engages. This is the parasympathetic nervous system.
Okay, how does the brake pedal work?
It operates via an entirely different chemical pathway, driven largely by a neurotransmitter called acetylcholine and heavily mediated by the vagus nerve.
So this is the rest and digest protocol.
Yes. Once the amygdala signals that the environment is safe again, acetylcholine floods the system. It acts as a biological dampener.
Nice. So it just calms everything down.
Yeah, exactly. It binds to the pacemaking cells of the heart and slows the rhythm down. It causes the blood vessels to dilate, dropping your blood pressure back to a resting state. It constricts your pupils back to normal.
And digestion starts back up.
Yes, it shunts blood back to your stomach and intestines, restarting peristalsis so digestion can resume. It restores homeostasis entirely.
So in a healthy, historically normal scenario, you have this beautiful dynamic interplay. The gas and the brake working in perfect harmony, keeping you alive and balanced.
Exactly how nature intended.
But here's where the modern human experience kind of breaks the machine, right? Here is the tiger in the supermarket.
This is the crux of the issue. During an anxiety disorder or a severe panic attack, the amygdala misfires.
It perceives a catastrophic, life-ending threat where absolutely none exists.
The software glitches, basically,
Yeah.
and the gas pedal gets jammed all the way to the floorboard.
So your adrenal glands dump that massive survival payload into your blood, and your body executes that flawless ancient survival protocol.
Right. It expects you to physically sprint for your life or engage in hand-to-hand combat with a predator, except you were just trying to pick out a yogurt in the dairy aisle.
The biological context is completely wrong, but the physiology is identical.
Exactly. The body is doing the right thing for the wrong situation.
And this brings us to a fact that I think is honestly the most liberating piece of knowledge for anyone listening who suffers from panic attacks. It's regarding blood pressure.
Ah, yes. The blood pressure myth.
Right. People who get panic attacks often buy these home blood pressure monitors. They feel their heart racing, they slap the cuff on, and they see their systolic blood pressure. The top number read 180, sometimes even 190.
Which is a terrifying number to see on a screen.
For someone already terrified of cardiovascular disease, seeing a 180 is absolute confirmation that they are having a stroke or their heart is exploding right there in the living room.
But when you actually dig into the cardiovascular physiology of acute stress, the reality is entirely different.
Tell us why.
That 180 systolic reading during a panic attack is not chronic hypertension. It is a perfectly normal, structurally healthy reaction of a strong heart to a massive adrenaline explosion.
This is such a vital distinction to make because chronic hypertension is the real danger, right?
Yes. Chronic hypertension, the so-called silent killer that damages organs over decades, is a state where your blood vessels are stiffened or narrowed. Your resting pressure is constantly elevated, forcing the heart to work harder 204/7 against high resistance.
But a panic attack isn't that?
No, a panic attack is acute hyperdynamic circulation. Your heart muscle is functioning beautifully. Your ejection fraction, which is the amount of blood pumped out with each beat, is huge.
So the adrenaline has intentionally spiked the pressure.
Yes, to ensure your leg muscles have enough oxygen to run at top speed. Think about it. If you were actually being chased by a bear, you would die if your blood pressure stayed at a resting 120/80.
Oh, absolutely. Your muscles would give out.
You need it to hit 180 to survive the sprint. So your body is not breaking down. It is operating at peak hyper-efficiency. It is performing a heroic, biologically expensive feat to save your life.
It's doing exactly what it was engineered to do. The only problem is there is no bear. There is just a cashier scanning barcodes.
Exactly.
Mm-hmm.
And because there is no physical outlet for that massive energy spike, I mean, you aren't actually running, you aren't burning off the glucose and the catecholamines, you are just standing frozen in line.
So that adrenaline just burns through your system.
It does. It creates an overwhelming, agonizing sensation of internal chaos. The tight chest you feel isn't a heart attack. It's the intercostal muscles between your ribs tensing up like armor to protect your vital organs from a physical blow that never comes.
That perfectly explains why anxiety is such a shapeshifter. I know in psychiatric literature, anxiety is famously referred to as the great mystifier because it never stays in one place. It puts on different masks to trick you.
It really is a master of disguise.
Today, your chest is tight and your heart is pounding. That's the cardiological mask. You go to the ER, they say you're fine. Tomorrow, you wake up incredibly dizzy, the room is spinning, and your fingers are numb. That's the neurological mask.
You book an appointment for an MRI, terrified you have a brain tumor?
Exactly. And the day after that, you feel this massive, hard lump in your throat. You can't swallow properly. You feel like you're choking. The respiratory mask.
Let's dissect the biology behind those masks, because demystifying the physical mechanics removes so much of the terror. Let's take that lump in the throat you mentioned.
Yeah, what is actually happening there?
In clinical terms, this is often called globus hystericus or globus sensation. Patients are routinely convinced they have esophageal cancer or some physical tumor blocking their airway.
But mechanically, it's something else.
Remember the gas pedal. The sympathetic nervous system is preparing you for a violent physical struggle. And your neck is a highly vulnerable area.
Right, a predator goes for the neck.
Exactly. So to protect your airway and your vocal cords from being crushed during a fight. The muscles of the larynx and the upper esophageal sphincter involuntarily spasm and tighten.
Oh, wow. So they lock down to form a muscular shield.
Yes, that chronic, tight muscle spasm is what you feel as a lump. It is defensive biological armor, not a malignant tumor.
That is incredible. It's like your body is putting on an internal neck brace. And what about the gastrointestinal mass? Because this is incredibly common.
Extremely common.
People often get sudden, violent nausea or an urgent, completely uncontrollable need to use the restroom right before a highly stressful event, like giving a major public speech or walking into a final exam.
That is another ancient evolutionary mechanism. It's
Huh.
designed to drop ballast.
Drop ballast, like a hot air balloon.
Exactly like that. Think about the physics of outrunning a predator. Carrying a stomach full of half-digested food or a bowel full of waste is metabolically inefficient and heavy.
You want to be as light as possible.
Right. So when adrenaline floods the system, the enteric nervous system, which is often called our second brain, located in the gut, receives the emergency signal.
And it just purges everything.
The body decides to rapidly empty the digestive tract to make you physically lighter and faster. It induces vomiting or acute diarrhea as a survival reflex.
It's brilliant on the savannah, but it is incredibly inconvenient and embarrassing when you're about to give a PowerPoint presentation to your board of directors.
It is the ultimate misplaced survival tactic.
Okay, but this brings up a really serious, practical question for the listener. If the symptoms of chronic anxiety or a panic attack can perfectly mimic a heart attack, a stroke, or an airway obstruction, how does a regular person differentiate between a neurosis and a real, dangerous organic disease?
It's a great question. We talked about doctors running tests, but what can the patient themselves look for?
Right. How do I know if I need to go to the hospital or just do some breathing exercises?
There's a brilliant, highly reliable clinical heuristic for this. We can call it the hardware versus software test.
Okay, explain that.
Your physical organs,
Yeah.
your cardiac tissue, your brain matter, your stomach lining are the biological hardware.
The actual machine parts.
Right. And your psychological state, your cognitive processing, and your nervous system's threat detection algorithms are the software.
Got it. And the key diagnostic rule here is the element of distraction, right?
Exactly. The distraction test is incredibly telling.
If your symptoms magically vanish or significantly diminish when you are totally engrossed in an incredibly gripping movie, or when you finally get to a resort on vacation, have a glass of wine, and relax, your hardware is perfectly fine.
That is the rule. A biologically failing heart, a blocked coronary artery, or a true neurological lesion does not care if you are watching a great movie.
It's not going to take a break because you're having fun.
Exactly.
Yeah.
It doesn't care if you're on a beach in Bali. It will fail regardless of your mood. If the symptom disappears or migrates when your attention shifts or your psychological stress drops, the glitch is entirely in your software.
That is the defining hallmark of psychogenic symptoms, isn't it? High variability and susceptibility to distraction.
Yes. Organic disease is stubborn. It is rigidly consistent. It hits one specific, localized physiological spot, and it stays there, progressively getting worse.
It doesn't move around.
No. If you have a real neurological lesion in your motor cortex, you don't feel weakness in your left arm on Monday, your right leg on Tuesday, and your stomach on Wednesday. Organic disease doesn't migrate around your body based on your stress levels.
But we have to be responsible here. While anxiety is a master mimic, real diseases do obviously exist. What is the checklist of red flags?
We definitely need to cover those.
When should a person bypass the software check entirely and go straight to a specialist to aggressively check the hardware?
The differential diagnosis boundaries are actually very clear. First, you should immediately see a neurologist or an oncologist if you experience symptoms appearing for the very first time after the age of 50.
Okay, why 50?
Primary anxiety disorders and panic disorders almost always present earlier in life, typically in the late teens to early 30s. A sudden onset of severe migrating neurological symptoms at age 55 warrants a deep hardware check.
That makes a lot of sense. What else?
Secondly, look for focal neurological signs. This means highly specific asymmetric deficits.
So like one side of the body doing something the other side isn't.
Exactly. For example, if the reflex in your right knee is completely dead while the left is hyperactive, or if you have profound muscle weakness on only one side of your face or one specific limb.
Because anxiety causes generalized tension, right?
Right. Anxiety causes systemic tingling or full body tension. It rarely causes localized unilateral motor failure.
Another massive red flag the sources mention is progressive, unexplained weight loss without dieting.
That is a huge one.
If you are eating normally but shedding pounds rapidly, that is a metabolic or oncological red flag. You need to get that checked out.
Absolutely. And regarding the throat mask we discussed earlier, genuine mechanical difficulty in the act of swallowing is a red flag.
Not just that tight feeling or a lump, but a physical inability to get liquid or solid food down the esophagus.
Yes. If you are actually choking on water or food gets stuck, do not assume it's anxiety. Go get the scans.
Okay, so if you have those red flags, go to the doctor. But assuming your medical tests are clean and your symptoms do migrate and correlate tightly with your emotional state, you are dealing with a software issue, a dysregulated autonomic nervous system.
They're dealing with anxiety.
And the critical question then becomes, why does this software glitch happen to some people and not others? I mean, why does an acute panic attack turn into a chronic, debilitating anxiety disorder for one person while someone else just shakes it off?
To understand that, let's look at the pathophysiology of chronic anxiety. We can break this down into scenario A versus scenario B.
Okay, let's set up scenario A.
Let's look at scenario A. You are a university student about to take a massive, career-defining final exam.
Classic high-stress situation.
Right. As you walk into the lecture hall, your sympathetic nervous system fires up. Sweaty palms, racing heart, dry mouth, tunnel vision. You sit down, you turn over the paper, you take the exam for 3 hours, and then you put your pen down. You walk out.
The situation is definitively resolved.
Exactly. The brain registers that the threat is over, and it signals the brake pedal. Acetylcholine floods the system, your heart slows down, your digestion restarts, and you go get a pizza with your friends.
The stress was acute, it was intense, but it had a clear, defined endpoint.
That is a highly functional, perfectly healthy stress response. It optimized your focus for the exam and then shut off.
Now let's contrast that with scenario B, which I think really represents the insidious nature of modern chronic stress.
It really does. Imagine a person stuck in a deeply complex, unresolvable dead-end situation. Maybe it's a corporate job they absolutely despise, working under a toxic, verbally abusive boss, but they have a mortgage and cannot afford to quit.
Or it's a deeply unhappy, emotionally draining marriage they feel trapped in.
Exactly. Or, quite often, the threat is entirely internal. They suffer from severe perfectionism and hypercontrol, meaning their own mind is a constant, inescapable source of pressure.
They are terrified of failing, of being judged, of getting sick. It is an exam that never, ever ends. You can't just walk out of the lecture hall.
Precisely. In scenario B, the brain perceives a constant, unresolvable existential threat. The biological options of fight or flight are completely blocked by social reality.
Because you cannot physically fight your toxic boss, and you cannot flee into the woods because you need the paycheck to survive.
Right. And because the conflict is never physically resolved, the amygdala never sends the all-clear signal. The alarm bell never turns off.
So the gas pedal remains jammed down for months or even years at a low but constant idle.
And this chronic activation leads to actual profound physical breakdown.
This isn't just a matter of feeling a bit stressed. This is cellular damage over time.
It is. This brings us into a fascinating field called psychoneuroimmunology, which is the study of how your brain's psychological stress directly alters your immune system's hardware.
Let's look at the endocrinology there. When you are constantly in that scenario B state, your adrenal glands pump out a steady, unending stream of the long-term stress hormone, cortisol.
Now, cortisol is great for acute survival, but chronic cortisol is highly toxic to tissue.
How does it damage the immune system?
Over time, elevated cortisol actively suppresses the synthesis of IgA antibodies. Immunoglobulin A is an antibody that lines your mucous membranes, your saliva, your respiratory tract, your gut.
They're basically your immune system's first responders.
Exactly. When cortisol suppresses your IgA production, you strip away your first line of defense.
Suddenly, you become highly vulnerable to every common cold, flu, and respiratory infection that passes through your office.
You literally worry yourself into an immunodeficiency.
That is terrifying. And the gastrointestinal toll is equally devastating, right? It perfectly illustrates how psychological stress creates physical disease.
It really does. Remember the blood flow shunting we discussed earlier?
Right, pulling blood away from the stomach.
When the sympathetic system is active, it diverts blood flow away from the stomach to the skeletal muscles. If you are chronically stressed for years, your stomach lining is in a state of chronic low-grade ischemia.
Meaning it is undersupplied with oxygenated blood.
Yes. This chronic lack of blood flow weakens the mucosal barrier of the stomach. It degrades the protective mucus layer.
And this opens the door for bacteria.
Exactly. Many people naturally carry a bacteria called Helicobacter pylori in their gut without any issues. But when your mucosal lining is weakened by stress-induced ischemia, that H. pylori bacteria suddenly has an opening.
It invades the compromised lining and causes severe inflammation, which leads to gastric ulcers.
So the anxiety doesn't directly drip acid into your stomach to eat a hole in it, but the nervous system creates the exact physiological environment of vulnerability that allows a dormant bacteria to destroy your tissue.
It's a perfect biological storm. Friends, if you are listening to this right now and recognizing yourself in these descriptions, if you've been living in scenario B, running from cardiologist to gastroenterologist with a phantom diagnosis, convinced you are physically falling apart, understand that you are not broken. You are stuck in a biological loop. We dig deep into topics of mental health here, relying strictly on evidence-based medicine. Make sure you subscribe to our feed so you never miss the tools and insights that can genuinely change your state of mind.
It is so important to understand that you are not broken.
It really is. But we need to transition from understanding the anatomy of the trap to actually dismantling it. We've diagnosed the jammed gas pedal.
Now we need to fix it.
The ultimate, most urgent practical question is, how do we stop this adrenaline fire once it has already started? If I am in the supermarket or on the subway and the panic attack hits, my heart is at 180, my hands are numb, what is the physiological override switch?
The very first thing you must understand and correct is the danger of hyperventilation.
Right, breathing too fast.
When we panic, our primal instinct is to gasp for air. We feel a crushing tightness in our chest. We feel like we aren't getting enough oxygen, so we start taking rapid, shallow, erratic breaths from the upper chest. We pant.
But biologically, chemically, this is the exact opposite of what your body actually needs in that moment.
This is the worst thing you can do.
Right, and it has nothing to do with oxygen. It's all about carbon dioxide.
Exactly. When you hyperventilate, you don't actually increase your oxygen saturation much. Your blood is already carrying about 98% oxygen anyway. What you do is rapidly wash carbon dioxide, or CO2, out of your bloodstream.
No, we are culturally conditioned to think of CO2 as just a toxic waste product that we need to expel.
Right. Breathe in the good air, breathe out the bad air.
But in human physiology, CO2 is a master regulator. It is crucial for maintaining the precise pH balance of your blood. When you hyperventilate and blow off too much CO2, your blood becomes alkaline.
This state is called respiratory alkalosis.
And how does the brain react to alkaline blood?
Poorly. Very, very poorly. The brain interprets the sudden drop in CO2 and shift in pH as a sign of massive systemic instability, even greater danger.
So it panics even more.
And it responds with a paradoxical reflex. It commands the smooth muscles in the blood vessels, feeding the brain to constrict.
Wait, it cuts off blood to the brain.
Yes. This vasoconstriction reduces cerebral blood flow. That is exactly why you feel dizzy, lightheaded, and faint during a panic attack.
Oh, wow. That is why people feel like they're going to pass out.
Furthermore, the alkaline state causes calcium ions in your blood to bind more tightly to proteins, dropping the level of free calcium.
What does that do?
This drop in free calcium causes your nerves to become hyperexcitable, which creates that terrifying tingling and numbness in your hands and around your mouth.
Which is a condition called tetany.
Yes. So by gasping for air, you are literally chemically fueling the physiological symptoms of the panic attack.
So if gasping for air is throwing gasoline on the fire, what is the water? Here's where it gets really interesting. The actual biological override switch, the key to immediate calmness, is not taking a deep breath in. The secret is executing a prolonged, agonizingly slow breath out.
We call this the long exhale method in clinical practice.
Well, that should work.
When you are in the violent grip of a panic attack, your immediate physiological goal is to artificially create a state of mild hypercapnia, Hypercapnia means slightly acidifying the blood by intentionally building up the concentration of carbon dioxide.
Let's walk exactly through how to do this for you, the listener, because this is a literal hardware hack for your nervous system.
It really is. First, take a gentle, normal breath in through your nose for about 5 seconds. Don't force it, just imagine your lungs are a balloon gently inflating.
And then you pause at the top for just a second.
And then comes the most important part. You must exhale incredibly slowly through your mouth, as if you were blowing through a tiny cocktail straw for 10 full seconds.
You have to physically restrict the airflow with your lips to make the breath last that long.
Imagine you are letting the air out of that balloon so slowly, it barely makes a sound. You repeat this cycle 5 seconds in, 10 seconds out, 15 times.
The neurobiology behind why this works is profound. By extending the exhalation to be twice as long as the inhalation, you intentionally trap CO2 in your circulatory system.
As the CO2 levels rise back to normal and cross slightly above baseline, two things happen. First, the Bohr effect allows oxygen to detach from hemoglobin more easily, oxygenating your brain and ending the dizziness.
Okay, so the dizziness stops.
Second, the rising CO2 physically suppresses the firing rate of the overactive amygdala.
But even more importantly, the physical mechanical act of a slow, controlled, resisted exhalation directly stimulates the vagus nerve, right?
That is the key. The vagus nerve is the massive cranial nerve that serves as the primary conduit of the parasympathetic nervous system.
When you stimulate the vagus nerve through slow exhalation, it dumps acetylcholine directly onto your heart's pacemaker, physically forcing the heart rate to slow down.
You are literally mechanically forcing the brake pedal to engage.
You are using your diaphragm to manually override the software glitch in your brain. Another highly effective variation of this is box breathing, which is heavily utilized by first responders, special forces, and the military to maintain calm under literal fire.
The pattern is very simple. Inhale for 4 seconds, hold the breath in for 4 seconds, exhale slowly for 4 seconds, and hold the lungs empty for 4 seconds.
The underlying physiological principle is exactly the same, strictly regulating the CO2 washout and engaging vagal tone.
The breathing techniques are incredible for acute physiological interruption. They stop the panic attack in the moment.
But we have to be honest here. Breathing alone will not cure an anxiety disorder. To truly reset the system over the long term, you have to pair the physiological intervention with cognitive reevaluation.
Right. Because if your brain still fundamentally believes you are in mortal danger, it will just hit the gas pedal again 5 minutes later.
You must consciously change how you evaluate the physical sensations in your mind. When the heart races and the chest tightens, the automatic, glitchy software script in your head screams, "I am having a heart attack, I am dying."
You have to use your prefrontal cortex, the logical reasoning part of your brain, to step in and aggressively edit that script.
You must tell yourself, this is just adrenaline. My heart is perfectly healthy. My body is doing exactly what it was evolutionarily designed to do. It just got confused by a false alarm.
This is a chemical wave, and like all waves in the ocean, it will peak, and then it must physically roll back.
And implementing that cognitive reevaluation requires you to do something incredibly counterintuitive and very, very difficult. You must live through the terrifying symptom without fighting it.
That is the hardest part for patients.
When you try to fight a panic attack, when you tense up and tell yourself, "I must stop panicking right now, this is unbearable, I can't let this happen," you are generating secondary fear.
You are afraid of the fear.
That secondary fear signals the amygdala that the threat is getting worse, which triggers another massive dump of adrenaline.
By practicing radical acceptance, by saying, okay, the gas pedal is stuck, I feel awful, my heart is racing, but I am safe. I'm going to breathe slowly and simply let this chemical storm burn itself out. You deprive the panic of its primary fuel.
Every single time you survive a panic attack without treating it as a medical emergency, without calling an ambulance or fleeing the supermarket, you induce neuroplasticity. You structurally rewire your brain.
You provide physical proof to the amygdala that its alarm was false.
Which transitions us perfectly into the long-term work, because rewriting those deep neural pathways takes practice. And sometimes getting in to see a specialized clinical psychologist right away isn't an option.
Maybe you're on a 6-month waiting list, or maybe you just want to start taking aggressive action to reclaim your mind today.
The clinical literature provides what they call a researcher's toolkit. This is bibliotherapy for the anxious mind. And my first reaction to this is usually skepticism. Can we really cure a severe physiological neurosis just by reading a paperback?
That skepticism is entirely fair, but bibliotherapy is incredibly powerful for this specific demographic. Anxiety is largely a disorder of cognition, a structural flaw in how we interpret data from our bodies and our environment.
And the books highlighted as the gold standard in these clinical protocols are not motivational fluff or think positive manifestos. They are structured, rigorous clinical tools.
The absolute gold standard, referenced across decades of literature, is Dr. David Burns' work, primarily his book Feeling Good, or his specific work on the therapy of anxiety.
For many clinicians, this is essentially the Bible for anxious people.
It really is.
I've looked at Burns' approach, and what strikes me is how incredibly mechanical it is. I used to think CBT cognitive behavioral therapy was just telling yourself, everything is going to be fine. But Burns' method is almost like math.
It's very logical.
How does he actually bridge that gap between logic and sheer panic? Because when my heart is beating at 180, sitting down with a worksheet to use logic feels like trying to do long division while my house is on fire.
That is the perfect analogy, and Burns addresses exactly that. You don't do the worksheet at the absolute peak of the 180 BPM panic attack. You use the long exhale for that.
Right. Breathe first, think later.
Exactly. You do the worksheet in the aftermath or when the generalized anxiety is simmering. Burns teaches you to use the scientific method against your own thoughts. He introduces the concept of cognitive distortions, which are essentially the specific software bugs in your thinking.
Let's simulate a worksheet based on our supermarket scenario. Step 1, write down the automatic thought. My heart is racing. I'm having a heart attack.
Step 2, identify the cognitive distortion. In this case, it's emotional reasoning. I feel terrified, therefore I must be in real danger and catastrophizing, jumping straight to the worst possible, deadliest outcome.
Step 3, draft a rational evidence-based response. My ECG last week was perfect. My blood pressure spike is a normal adrenaline response. I have survived 50 of these attacks before, and my heart hasn't stopped once.
It forces the prefrontal cortex to activate and override the limbic system. It dismantles the panic using cold, hard logic, providing a structural scaffolding for the mind when it feels chaotic.
And another incredible resource in this toolkit comes from Jennifer Shannon. Her book revolves around a concept that I think is utterly brilliant in its simplicity. Don't feed the monkey.
The monkey mind is a classic metaphor borrowed from Eastern philosophy, representing the restless, chattering, uncontrollable nature of our thoughts.
But Shannon applies it with surgical precision to clinical anxiety.
She does. If we look at the evolutionary psychology of it, the monkey mind is basically our brain's default mode network, constantly scanning the horizon for predators.
But the modern monkey mind thrives on our attempts to control the uncontrollable. It demands 100% certainty in a world where certainty physically does not exist.
If you are a perfectionist, if you suffer from hyper-responsibility, where you secretly believe you have to fix everyone's problems, anticipate every possible disaster, and never make a mistake, you are serving up premium, high-calorie monkey chow for your neurosis.
Shannon's book teaches you a devastatingly hard lesson. Trying to control the anxiety, trying to forcefully stop the thoughts, actually feeds the monkey.
You have to learn to tolerate uncertainty. You have to learn to let the monkey chatter in the background without engaging with it.
Expanding on that toolkit, we have Paul David's Return to Life. This text is crucial because it wasn't written by an academic psychiatrist in a pristine office. It was written by a man who personally endured and survived 10 years of severe, debilitating panic disorder and profound derealization.
Derealization is one of the most terrifying, under-discussed symptoms of anxiety.
For those who haven't experienced it, derealization is a dissociative state where the physical world suddenly feels entirely fake.
It feels like you are trapped in a movie, or looking at the world through a pane of dirty glass. The colors seem wrong, people seem like robots, and you feel completely, horrifyingly detached from reality.
People often think they have developed schizophrenia when this hits.
It is a severe, defensive dissociative symptom of extremely high anxiety. The brain is so overloaded with stress that it essentially tries to uncouple from reality to protect itself.
Reading Paul David's highly detailed account of how he accepted, lived with, and eventually overcame these exact terrifying sensations is deeply therapeutic. It provides a credible, battle-tested roadmap from someone who is genuinely in the trenches of severe neurosis.
We also heavily recommend Joseph Annaboli's Reclaim Your Brain, which is excellent for removing the crushing stigma and guilt.
Mhm.
It helps patients understand that their brain isn't broken or genetically defective. It is simply biologically overloaded by trauma, modern demands, or chronic stress.
And finally, Scott Stossel's Age of Anxiety, which provides a profound macro-level exploration of the genetic, historical, and pharmacological roots of our fears. It zooms out, helping you realize that what you are experiencing is a deeply human, historically universal phenomenon.
But even with the most rigorous bibliotherapy, there comes a point where reading is not enough, where self-help hits a wall.
How does a person recognize when they have crossed that boundary? When does it transition from I'm just a high-strung person going through a stressful period at work to a formal clinical disorder that requires psychiatric intervention like panic disorder, generalized anxiety disorder, or masked depression?
If we connect this to the bigger picture, the clinical boundary is almost universally defined by the concept of impairment. Are these physiological and psychological symptoms actively destroying your functionality?
Are you avoiding the grocery store entirely because you had a panic attack there 6 months ago? That is agoraphobia creeping in.
Are you constantly calling in sick to work? Has your sleep architecture completely collapsed?
Have the physical symptoms, specifically in masked depression, where the classic emotional sadness is entirely replaced by crushing, leaden physical fatigue, chronic migrating pain, and anhedonia lasted for weeks without a single day of relief.
If your baseline quality of life is severely compromised and your daily world is shrinking due to avoidance, it is absolutely time to seek professional clinical help.
And we really need to emphasize this because the clinical protocols are adamant about it. Asking for psychiatric help is not a moral failure. There is a massive, incredibly damaging stigma around seeing a psychiatrist or taking psychiatric medication,
People think if I take a pill, I'm weak. I should be able to just power through this.
which is a tragic, fundamentally unscientific misunderstanding of how the human brain functions under chronic stress.
Let's discuss the pharmacology, specifically SSRI selective serotonin reuptake inhibitors. There is a pervasive cultural myth that prescribing an antidepressant is about drugging a patient, masking their personality, or turning them into an emotionally blunted zombie.
The modern neurobiological literature completely refutes this. The analogy I always think of with the SSRIs is an audio soundboard. If my brain is the soundboard, chronic stress hasn't physically broken the speakers or severed the wires. It just pushed the panic and vigilance slider all the way up to maximum, and the slider got physically stuck there due to chemical exhaustion.
Isn't SSRI basically the biochemical WD-40 that allows us to unstick that slider and bring the volume back down to a normal human level?
That is a highly accurate way to conceptualize it.
To be biologically precise, chronic stress physically damages the architecture of your brain. Prolonged cortisol exposure actually shrinks the hippocampus, the area responsible for memory and emotional regulation, and damages the sensitivity of your serotonin receptors.
When you take an SSRI, it blocks the reuptake pump in the synaptic cleft, leaving more serotonin available.
But it's not a quick happy pill. It takes 4 to 6 weeks to work. Why? Because that increased serotonin eventually causes the postsynaptic neuron to downregulate its receptors.
This triggers a cascade of gene expression inside the neuron, leading to the release of BDNF, brain-derived neurotrophic factor.
BDNF is essentially Miracle-Gro for your brain. It stimulates the growth of new dendrites and synapses. The SSRI is physically remodeling and repairing the stress-damaged architecture of your brain.
It is a process of jewelry tuning your biochemistry. It doesn't drug you. It gives the brain the biological breathing room it needs to heal itself, returning to you the right to a normal, functional life.
It provides the stable biological foundation so that the real heavy lifting can begin.
And that heavy lifting is formal psychotherapy, specifically working with a practitioner on cognitive behavioral therapy. A lot of people have an antiquated view of therapy. They think it's lying on a vintage leather couch, staring at the ceiling, talking about your dreams, and blaming your mother for your problems for an hour a week while a guy with a notepad nods.
But modern CBT for anxiety is not that at all.
Not even close. CBT is highly structured, goal-oriented, and intensely practical. It is the active, scientific rewiring of your behavioral reactions at the physical level of neural connections.
A good CBT therapist acts more like a sports coach or a physical therapist for your brain. They will give you rigorous homework.
And the ultimate goal of CBT, specifically for panic disorder, is to break the deadliest loop of all, the fear of fear.
This is the vicious cycle where you are so terrified of having another panic attack that you become hypervigilant. You are constantly internally scanning your body for the slightest anomaly.
A totally normal, slight elevation in heart rate because you walked up a flight of stairs is instantly flagged by your anxious brain as the start of a heart attack.
Your fear of the panic attack triggers the adrenaline dump that causes the exact panic attack you were trying to avoid.
CBT breaks that cycle through exposure. The therapist will intentionally have you induce those physical sensations in a perfectly safe environment, maybe by hyperventilating slightly or running in place to spike your heart rate, so your brain can physically learn through repeated exposure that a fast heart rate is completely harmless.
It is the ultimate software upgrade. It trains the cognitive software to stop catastrophically misinterpreting the perfectly normal signals of the biological hardware.
Friends, speaking directly to you right now, wherever you are listening to this, remember, anxiety is not your enemy. That pounding heart, that dizziness, the numbness in your hands, the migrating aches, it is not a phantom vascular disease, and it is not a terminal illness trying to kill you.
It is a desperate, intense signal from your body that you simply haven't learned to read correctly yet.
Your nervous system is fiercely trying to protect you from a threat. It's just looking in the wrong place. You are fundamentally stronger than your adrenaline. Your hardware is remarkably resilient. And as we've seen today, there's a very real, deeply evidence-based scientific way out of this storm.
To leave you with one final provocative concept to mull over as we close this deep dive, consider this perspective shift. What if our modern epidemic of anxiety is not a disease at all?
What if it is actually an evolutionary superpower that just got misplaced in the 21st century?
Think about the brutal reality of natural selection. The biological mechanism that causes a panic attack is a brilliantly engineered, flawlessly executed alarm system. It was designed by millions of years of evolution to keep our ancestors alive on a highly dangerous savanna.
The person whose heart rate instantly spiked to 180, whose pupils dilated to take in every shadow, and who dropped all digestive weight the split second a twig snapped in the bushes, that person survived the tiger attack.
The relaxed person who ignored the twig got eaten. That hypervigilant survivor is your ancestor. You inherited a highly sensitive, hyper-efficient, premium survival machine.
It's just that today, that incredible biological machine is awkwardly and painfully misfiring in the cereal aisle of your local supermarket. It is being triggered by a vague, passive-aggressive email from your boss instead of a literal predator in the grass.
It is a feature, not a bug. Your body is working perfectly. You just need to learn how to update the software to match the safety of the modern world.
A misplaced superpower. I absolutely love that reframing. It strips away all the shame and leaves you with biology. So what does this all mean for you tomorrow morning? It means the phantom diagnosis of VSD doesn't dictate your future. It means you are not broken.
It means you have the power to engage the parasympathetic brakes, to rewrite the catastrophic script in your mind, to repair your neurochemistry, and to take your life back.
Please make sure to subscribe to our feed and, more importantly, share this deep dive. Right now, someone you know, maybe someone very close to you, might be fighting an invisible tiger. They might be secretly suffering from a phantom diagnosis, exhausted, terrified, and utterly convinced their physical body is failing them. This deep dive could be their very first step to freedom. Thank you for joining us, and we will see you next time.